Welcome to the module outlining the Ontario Pharmacy Patient Care Assessment Tool. This assessment tool will be used to assess the clinical practice component during patient care rotations. The module will briefly describe the development of this shared assessment tool and explain how to use the assessment tool. This module has been adapted from the Ontario College of Pharmacists training resources supporting the Practice Assessment of Competence at Entry, or PACE program. For more information on PACE, please visit the Ontario College of Pharmacists website at www.occpinfo.com. The Ontario Pharmacy Patient Care Assessment Tool was designed to be used across Ontario to assess the performance of pharmacy students, interns, and hospital residents practicing in a direct patient care setting. It was developed in collaboration with Ontario's two pharmacy university degree programs, the Hospital Pharmacy Residency Forum of Ontario, and the Ontario College of Pharmacists. The tool is based on the National Association of Pharmacy Regulatory Authorities Entry to Practice Competencies, as well as the Association of Faculties of Pharmacies of Canada's Educational Outcomes and the Canadian Pharmacy Residency Board Standards. The tool measures competence that is defined through behaviors observed and assessed in practice by a preceptor. 5 domains cover the main areas that the student will be assessed on: patient care, communication and education, professionalism, professional collaboration, and practice management. Each of these domains are further broken down into elements with descriptors of specific observable behaviors. A student's performance is measured using a 5-point rating scale. The preceptor should always rely on the behavioral descriptors rather than their interpretation of the rating scale. This slide shows the first page of the assessment tool. The heading in the top left corner is the domain. There are 5 different domains to be assessed. The row headings in the leftmost column are the elements of the domain. These elements are specific to each domain. The 5-point alphabetical rating scale is shown in the top row. A behavioral descriptor summarizes the student's performance that has been observed. Every rating for an element has its own behavioral descriptor. The next few slides explain the behavioral descriptors in more detail. The behavioral descriptors describe 5 levels or columns of increasing competency from left to right. Each descriptor is made up of 3 components: guidance and support required, effectiveness and quality, and consistency. This slide shows the progression of the 3 components in the behavioral descriptors for each element. A rating in column A would be appropriate for a student who, when given opportunities to demonstrate an element, is unable to do so despite guidance and support. A rating in column B would be appropriate for a student who can perform an element with significant guidance or support, is beginning to be effective, and is inconsistent in their performance of that element. A rating in column C should be given when a student is able to perform an element with some guidance and is effective but not consistent in their performance of that element. A rating in column D should only be given when a student performs an element effectively and consistently in their performance of that element. A rating in column E should be reserved for a student who is able to perform an element independently, effectively, and consistently. A level E performance may involve system-wide interventions such as organizational policies, workflows, and processes aimed at the structure and function of the practice environment that go beyond providing care to individual patients. This exceeds the performance expectations of students at entry to practice. When assessing the level of guidance required by a student, the preceptor should consider 3 factors: the initiative taken. Does the student readily engage in practice, or do they require prompting to act? The direction required. Does the student's behavior reflect a logical thought process and professional judgment, or are they uncertain how to make decisions? The assistance required. Does the student have the knowledge, skills, and abilities to practice, or do they need help filling in any gaps in these areas? The next slide explains the level of guidance required and how it relates to the rating columns on the assessment tool. The double-headed arrow on the left side of the screen shows the spectrum between significant guidance at the bottom of the screen to independently at the top. There are 4 characteristics to consider when assessing a student's need for guidance. Starting at the bottom of the arrow, a student who has difficulty taking the initiative or requires prompting, demonstrates inappropriate judgment, and requires regular intervention by the preceptor would be described as needing significant guidance. This would be a column B rating on the assessment tool. A student who positively demonstrates only 1 or 2 of these 3 characteristics would be described as needing some guidance. This would be a column C rating on the assessment tool. A student who readily takes initiative, uses appropriate professional judgment, and requires infrequent preceptor intervention would be described as needing minimal guidance. This would be a column D rating on the assessment tool. A student who consistently takes initiative and responsibility and uses judgment appropriately without the need for preceptor intervention would be described as independently on the guidance scale. This would be a column E rating on the assessment tool. Please note that demonstration of an independent thought process does not equate to unsupervised practice. In the assessment materials provided to you, there is a clinical practice assessment tool, OPPCAT, glossary document. This document lists the behaviors that should be observed for each element, sets the performance expectations for each behavior, and provides key definitions. You should review this document before starting an assessment period and when completing the assessment tool. It is also helpful to refer back to this document during the assessment to ensure that the student will have opportunities to address all of the elements for the preceptor to observe. When you're ready to complete the assessment, we encourage you to follow these steps. Consider the performance of the student throughout the entire rotation. Enter your comments on the student's strengths and areas for improvement for each of the relevant domains. Based on the student's performance that you had observed, assign an appropriate rating for each element. Please note that all assessments for the University of Waterloo patient care rotations will be completed online within the school's experiential software, Core Elms. When completing the assessment tool, please keep the following points in mind. Your rating should be based only on the student's performance that has been observed, either by you directly or in collaboration with your colleagues. Do not assign ratings based on the student's potential to perform at a higher level. There is no overlap between the behavioral descriptors for each element. A student who is rated within column C for an element will have met and surpassed the behavioral descriptors for columns A and B, and not yet met column D in its entirety for that element. All 3 components of a behavioral descriptor, guidance, effectiveness, and consistency, must have been fully demonstrated. There are no half ratings. If the student's behavior has not met any component of the behavioral descriptor, a lower rating should be assigned. We are now going to give you an opportunity to practice using the assessment tool. To assess the performance of a student and standardize your performance expectation ratings with ours, you will be rating her on 3 specific elements. 5.1 prioritizes patient care responsibilities to manage patient workload. 5.2 manages drug dispensing, and 5.3 demonstrates patient medication safety. These elements fall under the practice management domain. Before you hear the case study about Beth, review the assessment tool glossary document for these 3 elements to understand what behaviors are expected, and review the assessment tool to understand the different performance levels or columns for each possible rating. You will need to assume that this overview is typical of what you have observed from Beth throughout the rotation. After listening to the case study in the next few slides, we will ask you to reflect on Beth's performance. Be prepared to identify what she did well and what she needs to improve, and to assign a rating for each of the 3 elements based on your observations of her performance. At the beginning of her rotation, Beth would fill the simpler orders first when she noticed that the prescriptions were piling up so that she could spend more time with the patients who required more attention. When you asked her how she prioritized which prescriptions to fill first, she told you that she considered the patient's needs and level of care required. If she saw a parent with a sick child, for example, she would try to put that order first. By the end of the second week of the rotation, Beth was usually better able to prioritize and manage the workload. Beth learned the typical functionality of the dispensing software and asked you or the assistants for help as necessary. As part of the dispensing process, Beth double-checked the assistant's work to ensure that the patient received the correct product as ordered. As she checked prescriptions, she put a tick mark next to everything she checked. When you asked her to clarify what specific aspects of the prescription she was looking for, she identified all of the key considerations. Although you didn't mention this to her, you noticed that Beth did not always document the expiry dates of the products being dispensed on the hard copy, which is something you generally do when checking a prescription. She regularly reviewed the patient's profile to ensure that the medication was appropriate for the patient. She was diligent in her review to ensure patients received safe and effective care. As prescription flags appeared on the software, she could usually justify appropriately why she cleared the flags and dispensed the prescriptions. She offered counseling to any patient with a new prescription or if there was a change to the prescription. She had asked the assistants to inform patients that she was available if any of them had any questions. Before releasing medications, she confirmed that she was giving them to the right patient by asking them to provide their names and addresses rather than calling out the patient's name. There were no medication incidents at the pharmacy while Beth was there. She had asked the pharmacy assistants to correct seemingly simple aspects of the prescription, such as the doctor's address. When you asked her why, she explained it was because the patient's records were likely only at the address where the patient saw the doctor. How would you rate Beth on the elements of the practice management domain based on these observations? For the practice management domain, what were Beth's strengths? What were her areas of improvement? We found that some of Beth's strengths were prioritizing orders based on patient needs, developing a process for checking prescriptions, and being diligent in medication reviews, as well as offering counseling to all patients. An area Beth could work to improve would be documenting expiry dates when checking prescriptions. We'll touch on this a bit more when we discuss assessing element 5.2. Please pause this module and take some time to independently assess Beth's performance for elements 5.1, 5.2, and 5.3. In doing so, a reminder that the glossary document can be a very helpful tool. Once you've selected your rating, continue the module and we will share our rating and rationale for choosing that rating. For element 5.1, prioritizes patient care responsibilities to manage patient workload, Beth understood how to prioritize a workload based on patient needs and urgencies. For example, she would process an order for a parent with a sick child first. Teaching point: efficiency and speed is not an entry to practice requirement. Probing questions allow a preceptor to understand thought process in prioritizing workload. We would rate Beth in column D for this element. For element 5.2, manages drug dispensing, Beth used a systematic and comprehensive prescription checking process. Any flags were usually addressed appropriately, and there were no legal requirement concerns noted. New prescription orders, adaptions, and renewals offer excellent practice opportunities for students. Although documenting expiry dates when checking a prescription is good practice, it is not necessarily a legal requirement. That said, if it is policy to document expiry dates at one's place of practice, this is something that should be discussed with the student during an initial orientation. We've used this as an example to highlight the fact that a student's approach may differ from yours. The student should not feel they need to ask your permission, nor that they will be rated poorly if they use a different approach. Preceptors should always probe to understand the student's thought process. We would rate Beth as a level D for this element. For element 5.3, demonstrates patient and medication safety, Beth took initiative to correct files for continuity of care. For example, she asked the pharmacy assistants to correct the doctor's address on prescriptions and explained that she did this because the patient's records were likely at the address where the patient saw the doctor. Also, while Beth was at the pharmacy, there were no near misses or incidents mentioned. Teaching point. Level D is not the target level required to demonstrate competency in patient care rotations. In most cases, elements will vary within a domain. We would rate Beth as a level D for this element. This tool is designed to assess the student in a clear and objective manner. Valid assessment results require that you have reviewed the tool and associated glossary and understand what is being assessed and how to use the tool. This module is available to refresh your knowledge about the tool whenever you need it. For further questions about the assessment process, please contact your regional clinical coordinator. Thank you for reviewing this module.